Welcome to the Dental Implant Practices podcast, where each episode will explore how to integrate dental implants into your practice and into bone, with your host, Dr. Philip Gordon.
Hey guys, thanks for being listeners of the show. Go to dentalimplantpractices.com and find all of our resources. Also find us on Facebook, Dental Implant Practices page on Facebook, and go to iTunes and leave me a review on iTunes so we can help spread the message. Thanks. Welcome back to another episode of the Dental Implant Practices podcast. I'm your host, Philip Gordon. Today, it's a huge honor for me to introduce our guest, Dr. John Minichetti. John is a general dentist out of Englewood, New Jersey, and I'll let him do a little introduction. He's more than just your general dentist. He's a diplomate of the ABOI and does some teaching for the Maxi courses for the AAID. So, John, thanks for being on the show today.
Thanks for having me, Phil. It's an opportunity. I'm honored.
So I know I didn't do your whole intro any justice. So I'd love for you to tell a little bit about yourself, some of your dental education, kind of how you did your training, implant training, and how you went through the diplomate process.
Yeah, so my background is I've been practicing for over 30 years. I know I don't look it on the radio, but I have been practicing for over 30 years. And I got introduced, I was a general dentist. I did very well in dental school. I was thinking about going into periodontics at the time. Decided to do a general practice residency. I did one at Mount Sinai in Manhattan. During my residency, I started working for a prosthodontist in Manhattan, part-time. And he was involved with implant dentistry way back when. This is 1983, when it was in its infancy, when we were talking about the old stuff of blades and the Lenny Lincoln days and subperiosteals and crazy stuff. And I learned a lot of surgery at my residency, so I was really confident in surgery. I was thinking of actually going into OS, but I just started working with this guy and I got enthralled and loved this field of implant dentistry. I said to myself, this is the future of dentistry. It was barbaric at the time, but there was such a demand for these poor dental cripples who couldn't wear bridge work, who couldn't wear dentures, who hated their partials, who had failing dentitions. And these people travel from literally all over the world to see this dentist, this dental group, to get their teeth fixed. And I said, this is really the future. And I just stuck as a general dentist. I practiced at another general dentist practice in northern New Jersey. I joined staff at Englewood Hospital because, again, I was involved with surgery for a while. I would work out of the OR. I did surgical cases with the residents. I placed implants with the residents, back then blades. And then the root forms came in from Brandon Mark in the 80s. And I started taking courses. Actually, I wasn't allowed to take the Brandon Mark courses officially when they first came out because I didn't qualify as a prosthodontist or oral surgeon. So I ended up taking Jerry Nesnick's Corvent root form courses, and that was my first training in root form implant dentistry way back in the early 80s. And then from there, I kept taking every course. I would meet Carl Mission, a hotel, any course that was available. There wasn't a Maxi course back then. George's just started maybe in the early 90s, and then Crane started his course in the mid 90s, Maxi course, and I started teaching at those courses too. And I was teaching implant dentistry at the hospital and Fairleigh Dickinson University. I was on staff now, the dental school. And that's kind of my background in implant dentistry. From there, I just kept taking every course I could, and I was teaching courses and worked towards my fellowship and diplomat status.
Excellent. Now, I know that's a pretty rigorous status, and we'll dive into that more. Talk about the private practice that you're in now. You said you're in Englewood, New Jersey. Kind of talk to people how you got into that practice and kind of what that practice is like and what your day-to-day operations there are like.
Yeah, well, unfortunately, I'm in the group practice right now. Again, it's 30 years established, and basically a nice private fee-for-service practice. We are known for cosmetic and implant dentistry. We do general dentistry too. I have two partners who are general dentists. We're full-time. We also have a pediatric portion to our practice, which helps to generate business for the implant practice or the adult practice with a couple of pediatric dentists and an orthodontist. And we have a part-time periodontist who is in the practice. So it's a nice group practice. We also have an anesthesiologist on staff because we do IV sedation a few times a month for patients who are phobics or patients who need that for the surgical aspect. And we have our own on-premises laboratory. So it's I always had the concept of comprehensive dentistry. And I think that's really kind of the future of most dental practices. They're going towards the group. They're going towards comprehensive. They're going towards having multi-specialty practice under one roof because patients don't have time anymore to go from office to office. And within the practice, I'm the implant specialist, as you may say. And I'm more or less the prosthodontic implant specialist and who can coordinate a lot of these larger cases. And I work with my team in order to finish them up.
Excellent. Yeah, it's seems to be that's a good system that works. You can bring in various specialists and various generalists or prosthodontists or these implantologists in a practice and really have some good success because the treatment plans can be executed, all with one direction and patients can really get some good care with that. So now another big thing you're doing outside of that is you are doing some of the teaching of the New York AAID Maxi Course and the Las Vegas AAID Maxi Course. So why don't you kind of tell people maybe who don't know what those are, what those are and what that's about.
So again, I was always involved with teaching. I used to teach at the hospital and the dental school, and then I started getting more CE courses. And because I was so involved with implant dentistry, I did corporate courses at meetings, and I started a mini residency actually out of my office about 20 years ago. And it was teaching general dentists how to do implant surgery. It wasn't too popular at the time, to be honest. I got a lot of grief from some of my surgical friends, but they knew I knew my stuff. And I have a lot of guys who came out of that program and are diplomats of the AAID. So from there, I was asked to help with one of the Maxi courses that was going to start out in Las Vegas. That's how I got involved with the AAID Las Vegas course. And that was about 6 years ago. So I became the director of the Las Vegas AAID Maxi course. It's a 300-hour continuing education program. We run it out of the University of Las Vegas, Nevada Dental School. And it's about 8 modules over 8 weekends. And it has a lot of didactic. We get some world-class speakers there, such as Dr. Shankar Iyer, Dr. Bernie Dunson, Dr. Jim Murkowski. And these are all well-known people, Dr. Natalie Wong, well-known throughout the world. But besides the speakers, we usually have hands-on modules coordinated every weekend, such as suturing on pig's jaws or mannequin implant placement in a sim lab provided by one of the Zimmer Biomed facilities, or cadaver dissection and implant placement with bone grafting. So it's a well-rounded program that trains doctors, mostly GPs, although we have had some prosthodontists and some endodontists go through our program in implant dentistry. And then this year now, because of the success of this and because of people traveling actually from across the country, we're going to start a second AAID Maxi course here in New York City, in the Bronx, out of St. Barnabas Hospital that I'm on staff at. It's a hospital with a large general practice residency, 20 residents, 14 orthodontists, 12 peds, and no surgical specialties. So it's perfect for an implant program there. And we're going to be running the New York AAID Maxi course based on the other Maxi course we're running in Las Vegas.
Excellent. Yeah, that sounds fantastic. I know it's a very intensive program. Now let's break that down for someone who's listening that wants to take their implant training and do it right and build a foundation and really integrate this into their practice. And you said that's 8 weekends. Is that correct?
Yeah, our program's 300 hours, 8 weekends, some webinars, we have online assignments, reading. So it comes out to a total of 300 hours. And it's and it has that hands-on component, like I said, and there's also opportunities for doctors to do the live surgery. So what's important when you get involved with a field such as implantology, it's almost like orthodontics. You need time to digest. You can't do it in a weekend. You can barely do it in 2 weekends. You need time. So these are designed usually over a year. You're taking this knowledge back to your practice every month, digesting it, following up with questions. Our Vegas groups actually started a study group within the group. So they ask questions about cases, discussions, diagnosis, treatment planning, and they learn everything from diagnosis, treatment planning, CBC reading and scanning, planning, surgical incision, suturing, implant placement, bone grafting, socket preservation, sinus lifting, block grafting, ridge augmentation, and prosthetics. And getting that comprehensive background is, I think, essential in this field.
No, I couldn't agree more. You definitely have to take a lot of courses, and they need to build on each other. They just can't be the same 101 course over and over. It needs to be a foundation that, like a pyramid, that builds on itself and continues that educational workflow. So,
Absolutely. And the continuum part is important. There's with the director, such as myself or some of the other directors, because there are several other Maxi courses around. In fact, there's one going to open up in Chicago. There's one in Toronto. you have a director who gives you a certain theme or certain continuity of treatment. So even though you have guest speakers or you'll have different manufacturers presenting, it can't become too confusing for the students. It has to have a central theme to it.
Now, do you guys cover different implant systems or different kits or instruments, or is there any?
We do.
Yeah.
Yeah, we do. We try not to be any one manufacturer, which should be with any type of continuing education, the Sunshine Acts, etc. But not for that reason. But there's a lot of things. So we try to do a generic implant training program, talking about implant systems generically. Of course, we have different manufacturers come and talk about their own products at the time. In fact, we have vendors there, exhibitors, and people learn from that also. Hands-on components where you'll learn different components. But now this is, anybody can use any system, of course.
Yeah, of course. And there's always certain tools or instruments or tricks that work better for various things. And so it's good to have a well-rounded background in all those things. So Is this something that starts at a certain time of year and you've got to follow it through, or can you jump in at various times?
Well, we usually try to go with the school calendar year. So they usually start in the fall, at least ours do. We start in September and we end in June. So each program is going to do the same. It's going to start in September and end in June, although we have had some people sign up a little bit late, and then they can make up some of those courses either online or take it on the following year. But we do have a calendar year usually from fall to the spring.
Okay, so it's something they're going once a month for a full weekend for 8 to 10 months. And at that point, they've accumulated 300 hours of continuing education at the hospital through the continuum training. What does that do as far as setting someone up for a fellowship in the American Academy of Implant Dentistry? Because I know it's good to get training, but there's also, like you talked about, that implant specialty, working towards various accreditations and all that. How does that set someone closer to that fellowship?
Great question. Because, that's something that the American Academy of Implant Dentistry is very proud of. I'm actually past president, one of the past presidents of the American Academy of Implant Dentistry. And it was an honor, of course. But the Academy's mission really is to not only educate doctors, but to credential them, to so-called certify them as their skill level to the public. So we have certain credentialing levels where we test our members and certify them as either an associate fellow, a fellow, or diplomat of our academy, diplomat being the highest level. And diplomat being equivalent to what other specialties in dentistry have, such as the diplomatic boards. So the main purpose of the AAID Maxi course is that it gives you the 300-hour continuum, gives you the number of CE credits necessary to qualify to even take the written fellowship or entry-level exam with the academy. And most of our students do take that exam towards the end. We help prepare them for that exam. They get enough didactic knowledge that they can take that written exam and successfully pass. In fact, we have a very good success rate with our particular group because we prepare them so well. And then from there, they could put together their cases, unless they've been doing implant dentistry already. They may have cases, because the second component of the credentialing process is to evaluate the doctor's cases. It's an oral examination process. Since we don't have any residency programs per se established, with the exception of maybe Loma Linda and Brookdale, we have no way of really looking at the clinical skills of these doctors based only on a written examination. So we ask them to bring a certain case type to the examining board, and then they're orally examined on their case preparations.
Yeah. So do you feel if the AAID Maxi course is taken, students do well with that they're set up to succeed the written coursework fairly well?
Absolutely. Yeah. We have a very good success rate. It's in the 90 percentile plus. Yeah.
And then as far as the procedures, how tricky is it on the procedures? I know, some of these dental procedures can be very subjective. Obviously there's certain things you're looking for, but do you find that your success rates, if someone goes through a Maxi course and then completes the procedures, do you feel like those are pretty good conversions, or do you find a lot of retakes are necessary for some of those clinical procedures as well?
Are you talking about the testing procedures or the actual skill level to work in their practice?
Well, I guess the actual credentialing procedures part. I guess you feel they're comfortable to practice, but as far as accumulating the cases, do you feel like that's
that's
something?
Been one of the challenges for some of our students who do take the Maxi course, because within their private practice, some of them may not have the opportunity to perform implant dentistry. If they're in a certain group practice where they may not be allowed, or another clinician performing those procedures. That's why we give them some live surgical course opportunity. We have courses in other countries. We have courses in this country. I'm actually running a live surgery program here in New Jersey in June at probably going to be running it at Jersey City Medical Center this time and one day at my office, where they can get the skill set that they need now to perform these procedures in their office. Yeah, and they need that so they can accumulate the right type of cases. In the basic level, it's a single tooth, it's a 2 teeth in 1 arch, it's an overdenture type of case. So that's the basic entry level examination for doctors, and they should be trained. Most do get enough training that they can do those simple procedures when they're done with a Maxi course.
Yeah, and then the building can grow from there. So, any other benefits that you see for people taking this Maxi course that we haven't talked about? I mean, obviously we've talked about the credentialing and some of the continuum courses. I mean,
well, I think one of the biggest things, of course, not only if you didn't place implants, which some of the doctors actually don't, they take these courses for educational purposes, their understanding of dentistry becomes multiplied because they're now understanding dentistry much more comprehensively. Yeah, we just had this discussion because I did a few testimonials at our last program in Colorado where we had a cadaver section. And they just understand the concept of treatment planning more comprehensively. They understand a whole aspect of dentistry that they haven't been utilizing, which is implant dentistry. They're getting away from conventional RPDs or conventional crown and bridge or trying to save hopeless teeth, on and on with a postdoctoral with 6 pins. And they know the options that they have with implant dentistry. So I think in that aspect, that's one of the huge benefits that they bring back to their practice. I mean, secondly, of course, if they really are going to be serious about doing implants in their practice, they need to separate themselves to the public. Every street sign, every dentist is an implant dentist nowadays, as they are cosmetic dentists. So what's going to set you apart to your patient? If you have a valid credentialing, such as the American Academy of Implant Dentistry, which is a bona fide credential that says you completed these course hours and you have the clinical skills that you've presented your cases, now the public has a better understanding of really who's qualified to perform these procedures.
Yeah, I think, even if you're not going to be doing all these procedures, your understanding and treatment planning is much more directed because, these, like you said, these hopeless buildups and these lost techniques that you thought maybe 30 years ago were, worth tracking down, anymore. It's just, there's better ways to do things. And even if you're not doing it, you need to be aware of these in treatment planning and coordinating with specialists. It definitely makes you a better practitioner, whether or not you're the one actually doing the procedure or not. What do you see going on in the future for the AAID and the Maxi courses? I know you've been doing this a while. Are there any big changes on the horizon other than some of the titling and some of the specialist categories, which we won't go into necessarily on this one? But anything else? What do you see going on in the AAID? I mean, are the meetings a great place to start? I mean, what's the benefit of the AAID, and if somebody's not in that program, why do you feel it's such a good one?
Well, that's a very good program because I take a lot of pride. I love the AAID. It's been family to me, and I think that's what makes it kind of special to most of our members. We have about 5,500 members. We're growing at about 10% a year. Our composition is mostly general dentists, although we have about 20% that are specialists. So it's a great organization to get involved with for someone starting in implant dentistry. Why? Because not only do you get the benefits of your discounts, etc., for programs and courses, but you get to get all the information from the journals, from the newsletters. You can go to these district meetings and annual meetings. You start networking, and from there, mentoring with doctors who can help you learn. That's been a real benefit with the AAID. One of the big benefits, besides education, besides credentialing, the AAID is our mentoring and the camaraderie that the organization holds. It's a sharing organization. People that, such as myself, want to give knowledge to other doctors, and that's what the AAID stands for.
Yeah, I think, and especially in implant dentistry, there's such a huge need for that mentoring piece. As moving forward, there's going to be more and more implant dentistry on the horizon, and it's that passage of knowledge and technique and just the overall outcome success. You need to get that because a lot of these young dentists aren't getting it in school, so they're needing to get it somewhere. And I think that's the next step is like, okay, now what? You're a dentist. There's more, but it's like where to go to get it. And I think that's the important thing here.
Agreed. And I think that's not even, I don't think that's solely to dentistry, because I think as technology is evolving, It's no longer is it, you can just get a degree in college and you're done. It's constant continuing education in whatever field you're in. And dentistry is no different. So there's a lot to learn as a 4-year undergrad, and they do need additional education. And I even see the future as this field matures, being more specific with even besides Maxi Course, getting maybe into residency programs, et cetera, in the field of dentistry. I think that's where we're headed.
Yeah, absolutely. I think the guidance and the technique and the learning facilities are going to continue to embrace that, and we'll see where that goes, and hopefully it's in a good direction. So, what are you excited about in implant dentistry these days? I know there's a lot of changes all the time. What's exciting for you other than the teaching aspect? As far as private practicing, you're a pretty accomplished doctor, and what gets you excited about implant dentistry? For someone who's kind of been there and done it all, what kind of gets you up in the morning and gets you going?
Well, hey, I still get excited over bread and butter implant dentistry. It's really a miracle to give people teeth. I'm telling you. There's nothing like it, and some of the cases are very challenging. So it's not just getting up in the morning. You get some young girl with a set of veneers or whatever, all of a sudden one tooth is fractured off. I mean, I've got one of these cases right now, and it's a high smile line. It is challenging, and it is this woman's life. So I know it's only aesthetics. Or on the other extreme, the stuff we're doing now with, immediate full arch restoration, where I wouldn't think of doing some of that stuff years ago, or I did it with the older techniques, such as the subs and the blade, putting full root form restorations and restoring it digitally with some of these all full arch zirconium techniques. It's unbelievable. The digital dentistry, CT scanning, it's changed so much since I got over 30 years ago. So I still have to push myself to learn too. That's why I like teaching.
I think the interconnection between patient and CT and dentist and lab, that interconnecting of all those pieces to where, a dentist can do all the virtual planning and then do the surgical planning and then the restorative. I think it's an exciting time for implant dentistry, and, hopefully that continues to get better and better. I don't know how it could, but each year or two, there's another big evolution of something. So I think it's just fun to kind of see what different people are doing and how to incorporate those into your practice, and kind of fun to see as the field grows, everybody kind of giving and contributing to that.
Absolutely. I agree.
Yeah,
absolutely.
If somebody was wanting to take the Las Vegas Maxi Course or the New York Maxi Course, obviously there's some deadlines coming up. Maybe there's some things they need to think about. There's a lot of dedication to these. It's not just the cost, which really I think per CE hour is pretty darn good, but it's really the time away from your practice and the time away from your life is, I think, where the bigger.
The big commitment.
The big commitment really lies on those two. How does someone start thinking about that? Okay, I'm ready to do it. I think maybe this is the year. What are some things people need to think about? Obviously, can I book off? Can I get the flights? Can I stay? What's something that someone needs to think about, or what can you tell somebody who's on the fence and is this the year or not that I do this? And
yeah, I think it's important for them to do. I mean, they should do some research. They should. Contact either the American Academy of Implant Dentistry. On there's the website. They can speak to the central office there. They know about the various programs. If they're interested in one of our programs, they can certainly go to our website, or if they Google Las Vegas and AAID Maxi Course, it'll pop up. So it takes them to our website describing all the programs, describing each weekend. And then from there, we have testimonies of different doctors, or we give contacts for different doctors, and they should call. They should call up past students and find out what's their experience been, and what they feel the value of this program is. And I think once they do their homework, they'll decide on the right program and make that commitment.
Yeah, because it is a commitment, and you do be able to. You do need to be able to mark off a certain amount of time and responsibility for that, and you want to take that seriously. And so it's. I assume this is something that. Like anything, it's a big commitment, but once you do it, there's probably not been one person who says, gee, I wish I didn't do that.
No, everybody's been very, very happy. The surveys have been very good on our program, and we're proud of that. Yep.
Anything worthwhile, takes a commitment. And so it's good that these type of things are set up. Is there anything else that you would want people to know that are listening to say, hey, what are the top questions you get, or what do you think someone still needs to know? I know we've covered a lot of ground. Is there anything I've left out as far as asking you?
Yeah, no, I think we did a good job, Phil. I think, we went over the importance of the AAID and maybe becoming a member of that, the camaraderie, getting involved with implant dentistry. certainly if you want to become involved with implant dentistry on a real basis, think about taking a continuum program such as the Maxi courses that are available through the AAID, and then consider getting your credentials if you're going to get serious about this field. I think you got to be totally committed. You got to be either in or you're not in, and I think it's been a worthwhile field. It's done me well. I love implant dentistry, and it's really been a fulfilling life dream.
Yeah, I think I love dental implants. It's the fastest growing part of my practice. It's really the one thing that if I could spend almost all my time doing, I would just assume do more of that. So I'm going to put on a limb and say, my goal is to, over a 5-year plan to, hopefully become certified and a diplomate. And I'm going to give it a try. It may take longer than that, but
awesome.
I'm just going to put that out there. So I think I'm going to look to join you this fall in Las Vegas. So
oh, wow.
So I'm going to look into that.
Thank you so much. Love to have you.
Go through the process with you and put myself out there, and then I'll just kind of report as I go through it. Hopefully to get the people that are on the fences to jump in with me. So
sounds great. We'd love to have you.
Well, that's great. I think this seems like a good place to cut off. I don't know if there's any more questions that I haven't had for you, and I think we covered a lot. So I guess the best place to get a hold of you, like I said, is through the AAID Maxi Course.
Yeah.
Check it out.
Yeah, you can go to Las Vegas AAID Maxi Course, or you go to AAID.com. Either one.
Perfect. And then are you going to be at any of the big lectures this summer? When's the annual AAID meeting?
Yeah, we have a couple of programs that I'm going to be involved with right on the agenda. I'm going to be in Chicago in June for our Western Central District AAID meeting. We should have about 200 people there. I'm actually going to be meeting my Las Vegas group. They'll be taking their examination that weekend. Then from there, me and Dr. Matthew Young, who's also he's one of the past officers of the Western District, we're putting on a cadaver course, weekend course at Tufts University with the AAID. Then in October, me and Dr. Matthew Young will be headed to Atlanta, Georgia. We're going to be putting on another cadaver course, bone grafting and implant placement course with the American Dental Association for the AAID. And then we have our annual meeting, and I'm scientific chairman of our 2017 annual meeting in San Diego. And it should be a great meeting. We should have about 1,200 doctors present. We have some stuff we have some great speakers, Michael Picos, Bolshi, Palomalo, Isfan Ubin, Jaime Lozada, all the greatest names in implant dentistry will be on the main podium. We have about 20 workshops. We have a sedation course with Dan Becker all day. We have a cadaver course at the University of San Diego Medical School. And we have a live surgery program as our post-conference course, Tijuana, Mexico. It's going to be an awesome program. I'm proud to be part of it. And if anybody wants to come, 2017, San Diego.
Now, that sounds like a fantastic lineup. What time of year is that one?
That is going to be in October 13th. Yep, October 12th through 13th. Yep.
That sounds like a fantastic lineup. That seems like it'd be hard to miss. Well, I'll try to catch you there, and if not, I think you'll be seeing hopefully a lot of me this year at the course in Las Vegas, and looking forward to that. And I know you're a busy guy, so I appreciate you taking some time out of your schedule and talking with me and my listeners, and we'll get this posted soon and shoot it your way.
My pleasure. You did a great job, Phil. Thanks so much.
Hey, thanks for your time. Bye-bye.
Thanks for inviting. Bye-bye.